Hey everybody, welcome back. I'm Sarah.
And I'm Petey.
And today we're on episode 107, How Ketamine-Assisted Psychotherapy is Transforming Mental Health with Dr. Eric Milbrandt of Oasis Wellness and Recovery.
Ooh, I think a lot of people have been waiting for this episode, Sarah.
Me too. Ever since I have met Dr. Eric and spoken with him, he is such a beautiful wealth of knowledge and so kind, and he shares it in a very understandable way. It's very digestible, and I love who he is and how he operates as a doctor because he's very human focused.
Yes. Yeah, I loved meeting him on the panel when you
Yeah.
were on that with him. It was, yeah, he's so genuine. He's just so authentic and he's so knowledgeable. Oh my gosh. Every time I hear him, I learn more and more and more and more.
Mm-hmm.
So wonderful interview. Absolutely.
Yeah.
Yes,
And this
yes.
is an interview to kick off our next season because we took a nice little break.
After, yeah.
And in that break, we have actually had 2 retreats that we haven't even gotten to talk about on the show.
I know, I know. And
Yeah.
both of them were so special in their own way. So
Yeah.
different.
In November, we did a really great one at Center Street here in Orlando. And that was about like diving in. You led people through the Akashic Records. I did
Yes.
some awakening to understand your golden shadow, those positive parts of
Mm-hmm.
yourself that kind of got dismissed when you were younger. And it was a very sacred day, I would say. It was a very, that day, the energy was very sacred and spiritual, and people were really ready for deep healing.
Yes.
Yeah.
I think it was, we maxed out at 27, the
Mm-hmm.
most wonderful women. It was
Mm-hmm.
all women this
Yeah.
time. And it was, wow, they just raved because it was an entire day with lunch and dinner.
I know, like a 9 to 7, just locked in. We packed
It
it full, and
It
it was great.
was. It
Yeah,
was a beautiful group of
I
souls.
love that
And then,
space.
yeah, and then we kind of led right into the next one.
Yeah,
It
after the
was
new year, we went to Atlantic Center of the
for
Arts
the
at
arts. Yeah.
ACA in New Smyrna Beach, and that was a weekend. It was so beautiful. People could stay overnight, and this was the, if that was about like really, you know, almost like that deep sacred spiritual inward work, this was kind of the opposite side of spirituality, where we were accessing spirituality through creativity and play and understanding how to manifest through quantum physics. And that was
Yes.
really an amazing weekend to fold in all of the creative aspects of spirituality.
Yes. Well, if anybody has not been to the Atlantic Center for the Arts, they specialize in this. And so each building is dedicated to a different activity that you can do within it, which was so, people just thought they just loved that.
Yeah.
So from the dance studio where we did all of the yoga, and then going to the painting studio with the skylights, bringing in this beautiful, bright light. And after I guided people to listen to their soul, to their higher self, they silently walked to the art studios with their canvases that were
Well,
all
why there was
prepped from
live music
before.
playing, and we brought in, an
Yes,
artist to be the
yes,
facilitator for the painting, and it
yes,
was
yes.
really beautiful to see how people were able to go from, the guided visualization, this inward journey,
Hmm.
into then create it into a canvas. And we also prepped them with other stories, a haiku. They kind of
Oh,
they shared.
yes,
It was really, actually, I love the part at the end when we did the gallery tour and everybody kind of stood
yes.
by their wall. We spun them around and people shared their story, and because there's so much about sharing your story, being witnessed in it, and then being able to witness others in that.
Yeah, it was fascinating.
I couldn't believe it
And
was
the
so
other,
two nights, 3 days. I mean, it felt like a week,
oh,
honestly.
and everybody else said that
Yeah.
too.
Mm-hmm.
Yeah. And another unique thing about the Atlantic Center for the Arts is they literally have a grand piano in every
Everywhere.
space, almost. And we had someone, yes, and he was very special
Mm-hmm.
and played the piano. And there
Yeah.
was just so many wonderful pieces that we
Yeah.
brought
I
in.
think
Yeah.
about I always reference ACA as this like artist playground. And
Mm-hmm.
when we saw the space, that really informed the retreat, which was cool. It
Yes.
kind of let this have this blank canvas to invite these pieces into it. I mean, even, people know I did improv class over at
Yep.
Sat Comedy. I took it. And so I
Yep.
led an hour of that, which was great, right? It's all
So
about
fun.
getting out of your normal patterns and breaking free of just like those beliefs and thoughts you have and stepping into something new. And I mean, it was cool to see people, everybody was engaged and ready. And I mean, that was, I
Well,
don't know, I had a lot
honestly,
of fun that weekend.
it was the first time I had done improv. So I
No,
mean, I
really?
just thought, yes,
Oh
I
my
hadn't done it
gosh.
formally before, and it was such fun. That was
Yeah.
such fun. It
Yeah.
was, yes, everybody is, we have everybody on the group chat,
Yeah.
following it, and everybody's like, okay, when's the next one? What are we doing next, ladies? Where are
Yeah.
we going? It's very affirming because it was really two different groups of people. It was,
Mm-hmm.
I mean, there was a few that overlap, but overall, it was two very different groups of souls that attended each one. So,
Mm-hmm.
so
Yeah.
fun, and always fun to do with you, Sarah.
Totally.
Always fun.
Well, and I think, there's some stuff on the horizon given this conversation we're having about ketamine
Yes.
therapy and what that will be, because it has been really transformational for a lot of my own healing. So kind of getting into some of, the quirky insights of we've both now experienced this work, which I'm so excited you
Yes.
tried it, Mom.
Oh, yeah, I had to try
You had
it.
to try it.
I had to. I absolutely
Yeah.
had to.
Yeah. Yeah.
Yes.
So for people who don't know, I have worked with psychedelics for a while. Not with ketamine, but with psilocybin. And I had my own stigma around ketamine. I had only heard it about as a horse tranquilizer. I didn't really know about it. I knew people who did it at clubs. I was like, I don't understand how this is therapeutic. So I was like, well, let me pop my own stigma. Let me not, like, this isn't, fair. Like, let me look at what this is. And, I come to learn that I knew it was a horse tranquilizer because, well, they do use it with animals, but it's easier for
Mm-hmm.
people to steal from a vet clinic than a hospital. So that's why it was
Mm-hmm.
known on the streets as that. But last summer, I turned 40 in July, and that's when it was actually that week of my birthday, I believe. Yeah. I tried it with a ketamine therapist here in town, and it was unbelievable. So, ketamine is a dissociative anesthetic. So, what that means is your body gets really calm while you are
Mm-hmm.
reprocessing pieces of your life. It's usually about a 75 to 90-minute journey, eye mask on,
Mm-hmm.
headphones on, your body just starts to really relax. And so, to share a little bit, my intention that time was around having my adult self go back and heal and protect my younger self.
Mm-hmm.
And so, just like hypnosis, not everybody's visual in ketamine. Sometimes people are, sometimes you have this knowing. I land in the middle of like, was it visual or do I just really know what it is? And it becomes it's like the image I know and I think I see it. I don't know. So,
Mm.
does that make sense?
Yeah. But you're visual when we do regressions and hypnosis, aren't you visual then?
I'm visual, but it's not like it's like bright, like I feel like you talk about.
Mm.
I think I just know what it is. And
Mm,
then the
okay.
knowing of the images then makes that image. Yeah.
Mm.
I just go with it.
Yeah.
I just trust it and I just go with what's happening. Whether I know it or see it, it's just there. So in my journey, I saw myself, I landed at my biological dad's apartment when we were kids. And a lot of people know
Mm-hmm.
if you're new to the podcast, if you went back and listened to all the podcasts, that's where a lot of my root traumas land.
Mm-hmm.
Was you and dad divorced when I was 5. My brother and I went to my dad's house every other weekend, and that's where a lot of the just violence and yucky stuff happened over there that I've been unpacking for the last 4 decades.
Mm-hmm.
So in that journey, I saw myself, it's a music journey that you're led through it, and I saw myself kind of running away from dad in the apartment. My brother and I
Mm-hmm.
running away, saw us land in the bathroom, and then dad trying to get in there and maybe hurt us. But then I saw myself, adult self, stand between. And that was the first stepping between of protecting younger me,
Mm-hmm.
my brother, younger from dad. Then I saw music change, moving through the house, kind of like running, dancing around, moving quickly, a little scared still in there. Scary, but I wasn't feeling scared. I know I was
Mm-hmm.
scared, but what's really neat about this medicine is I don't feel it. I am
Yeah.
purely the observer noticing it. I'm like, oh, she is scared. But the first time I've ever gone back into childhood trauma and not felt it, which is like beautiful.
Mm.
So running, running, running. And then all of a sudden, I have a wand that I am now wrapping dad in this like wand of light,
Mm.
enveloping in this like light and protection and safety. And it wraps all the way around him, probably for the whole song. I don't know. The time just distorts in there. Um, and then I feel the separation from my adult self, younger me, younger brother, and from him, where there is this safety. I feel protected by the light. He's over there, and there's this rejoicing where all three of us hold hands and are kind of like dancing in a circle and rejoicing, and that like him and his energy can no longer affect us now.
Mm.
And so it was wild to feel because, as you know, after I had that experience, I shared with people what it was, and it was like, wow, this really reconciled within me. And the way I know trauma therapy to work, the memory gets updated. It's paired with this really regulated when you pull up a memory that is traumatic while you are deeply regulated in your nervous system, that
Mm-hmm.
reconciles it while you get this new learning. So now the memory got updated, but I could feel where it's like, yeah, this feels different. It's different. And then that's how I kept working with the medicine. It was really interesting about like, if I was working on any kind of rejection or abandonment wounds, I'd ask the intention, where do I want to go? That's what I'd like to seek. And I'd be open to the journey and would kind of go in and find these moments where I felt that in my relationship and like the core wounds for, childhood. Sometimes it would bring me to spaces where it's like I was dancing in the ethers in the spiritual realm and
Mm.
connecting to source. Sometimes it was like me trusting my journey moving forward or mending my heart with like, remember I told you I was like mending my heart with like
Yes.
gold that they do in
Yes.
Japan when clay is broken, you mend, mend,
Right.
mend.
Mm-hmm.
Such a beautiful tool that has been so pivotal for me in my healing and extracting these deep wounds.
Nuggets. Nuggets.
Yeah, they just kind
Yeah.
of I've done a lot of work and I've healed a lot of pieces, but it like kind of was the last thing to really pull it out,
Mm-hmm.
and it did. And so I just am such a believer in it. So since that time period, I got trained and then started guiding people, and now I'm leading groups. and it and I think because it's such an authentic share, it is.
Yeah.
I'm just sharing how much it has helped me, what it does for the nervous system, and you guys will hear about this from on the podcast with Dr. Eric. But it's powerful what it can do. It's just a great tool to really dive in. And
And since then, you've probably done about how many journeys now?
myself, probably about like
Mm-hmm.
eight, maybe about eight
Yeah.
journeys. Yeah.
Yeah. So, and it's similar each time, do you feel?
No, every
It's
time is
always,
completely different.
ah,
No time is
yeah.
exactly the same. Everything, sometimes it's inner child work, sometimes it's spiritual work, sometimes it's just images, sometimes it's just like a little bit darker and naturey and feel goody and remembering that
Hmm.
there's something bigger out there and all the other little things doesn't matter. All the human stuff we get stuck on can just kind of go away. So that's where,
That sounds
really.
familiar.
Yeah, right. Yeah. It always, like sometimes we want something from the medicine. We like, but that might be the ego where it really does show you what you need to see in order to heal.
Mm-hmm.
And, I'm such
Mm-hmm.
a believer that, so open to what will be there. So trusting, especially from all the work with the hypnosis and going into the subconscious. Um,
Mm-hmm.
yeah. Yeah. So it's always different. And it's a tool that I pick up now and again when, things get crunchy, when stress happens, when something maybe heavy happens, and then I don't need it for months. So
Right, right.
And it
And
really
he
does feel
speaks
like
to
it
that,
healed.
yeah.
Yeah.
Yeah. And he speaks to that in, well, both of you, you and he spoke to this in the
Yeah.
interview. Fascinating interview. Yes,
And
yes.
so much so that you got curious about working with the medicine too.
I did. I got very curious. I'm like, oh my gosh. I had never done psychedelics ever in my entire life. And I'm like, okay, let's see what this is all about. I trust you. I trust
Hmm.
your experiences and listening to you. And yes, it definitely sparked my curiosity. So after going to Center Street and listening to the panel of you and Pam and him and Iman,
Hmm.
yeah, contacted Pam and said, okay, let's do this. Let's do
Yeah.
this. And loved her personality as well.
So for
And
those listening, Pam is another therapist. She got me
therapist.
into the work, and her and I and Aman, we all working together to run ketamine groups at for people to be held in a group space.
Yes.
Hmm.
And so, yes, and I did ask Ron if he minded if I talked about that he did the journey as well, and he said he was fine with it.
Hmm.
So,
Hmm.
as 76 years old, he's a little bit older than I am for sure, and we she came out to our home, and so we didn't have to drive after the
Yeah.
experience, and that was so kind and wonderful. And she was fabulous, and we both set our intentions. He was a little bit more nervous. I'm always pretty open to like, okay, let's see what this is all about. I'm so curious.
Yeah.
And we both set our intentions. Mine specifically was all about being calm as the passenger, particularly, well, it's really with anybody driving was my intention. But, with Ron driving, it had become, a stressful event in my life.
Well,
Didn't
I mean,
know
your dad was a crazy driver.
my father was a crazy,
Like so
crazy.
unsafe. Yeah, Pop was so unsafe.
Yes. He would sit on people's bumpers,
That makes sense. Yeah.
literally.
Yeah.
I mean, and listening to my mother have anxiety constantly in the car, yelling at him to slow down. Jack, slow down, please slow down. And so as a child, listening to this all the time,
Yeah.
all the time, which definitely came back to
Yeah.
root. Yeah. And so I was very
Which,
anxious.
for people to hear, Ron is like the safest driver.
He's great. He
The
is a great
safest. The
driver.
complete
Yeah.
opposite from Pop. Yeah.
Yes,
Yeah.
yes. He does not do that.
No.
Like he is very, very safe. And I know that, and I've always said in my brain, if there was ever a difficult situation, there's nobody else I'd rather be with because I know
Same. Yeah.
his reactions are so wonderful, And so, but my anxiety
Your
side
body.
just takes over. Woo,
Mhm.
yeah, my body gets stressed, and I'm always in this high alert. High alert. Nowhere else in my life am I ever like that. So, yes, here we did this journey, and the two of us, and he was working on his things, and that was my intention. And wow, I was like, and I know everything that you've said about it, but boy, how the body disconnects from the mind, never experienced that anywhere else in my life,
Yeah.
like nowhere.
No.
Nowhere. I kind of thought, oh, is it going to be similar to hypnosis, And it's like, nope. I mean, I'm relaxed when I go under as quickly as you do, but geez, no, it's different. It's just totally
Deeper,
different.
more disconnected. Yeah.
Yes.
Hmm.
And then the music with it. Oh my gosh, it's just transformational. I like, no, I'm holding my heart. I'm like, wow. Because it was such a wow for me. I remember just thinking, wow, the colors that I saw. And I immediately was out there in the universe. I was in the cosmos and I was traveling, and felt magical to be so disconnected from my body. And all my takeaway from the first piece and being in the universe, it was just like, why does this bother me?
Hmm.
Goodness gracious, it doesn't even matter. It just doesn't matter. All I kept hearing was, it doesn't matter. It doesn't matter. In the grand scheme, this
Yeah.
is so nothing to be concerned about. It's just when you're out there in the cosmos, it's just like, I'm worried about Ron driving. Oh my gosh. No, this just doesn't matter. It
Yeah.
just doesn't matter.
Yeah, when you
And my
experience like awe and wonder, it looks
Yes, and my body was so calm. It was just so at peace.
mm-hmm.
It was magical. And then like I told you, and then I saw a lighthouse. Nope, I was the lighthouse. That was incredible to me. I had this enormous light looking out over the ocean. It was dark at night, and I could see for miles and miles. I could see as the lighthouse for
Mm-hmm.
miles and miles and miles. And it was just all the feeling I kept getting was I was there to cast a light for others that couldn't
Mm-hmm.
see.
Beacon of light.
And
Yeah.
yes, to
Mm-hmm.
be that beacon of light, which has been kind of my purpose in this lifetime forever. And it was just, yes, I went from one scene to another with this magical music. I love the music. I was from the lighthouse. I went up to the desert island. I was thrilled to be by myself. Probably because I have so much stimulus around me all the time. I
Yeah.
was thrilled. No fears, no anxiety. No, I mean, it was just the most fascinating. It was like 75 minutes,
Mm-hmm.
and both Ron and I came out pretty much at the same time.
Wait, what about the wolf?
Oh, yes, yes. Then
Mm.
I didn't know if you wanted me to say every
Well,
scene.
that piece is
Yes.
like pretty that relates though,
Yes.
to your intention.
So then it was there was a wolf's head just like inches from my face, and I with these vivid crystal blue eyes. And I remember thinking, am I the wolf? And no, I wasn't the wolf. And I remember asking the wolf, are you taking me somewhere? Are you here for a purpose? And then he went running off. And then I was a wolf next to him, following him. And I could not believe the speed we were going, which is interesting, right? Because I was there about being in a car. Oh my gosh, we took off. We were in the Arctic and just jumping over I don't know, rivers of ice and
Mm-hmm.
running on the ice and just, I mean, running and leaping and bounding. And I was following him. And I thought, and also I kept feeling was, this is fantastical. Oh my gosh. Speed is so much fun. I remember thinking, speed is so much fun.
Oh.
And because we were just, there was not a care, not a
Yeah.
fear, not a concern. It was like, oh, we're going to do this again. So I was the wolf with the wolf and, showing me there's nothing to fear. Nothing to fear from speed. It was like I felt totally in control. It was magical. It was truly magical.
Have you
Yeah.
been in a car? Have you driven with Ron?
I was that very weekend. We had to drive into Orlando for our granddaughter's birthday.
Mm.
I drove out there because I just love to drive too, but he drove on the way home, and it
Oh,
was
at night too?
nighttime,
Mm-hmm.
which is always harder for me because I do have stigmatism, so
Mm-hmm.
perception is
Yeah.
difficult for me. It was nighttime, tons of traffic. Tons of lights coming at me, which is
Perfect.
hard. Yes, which is perfect. And I remember we set out from Orlando and it felt like, oh, wow, he's going kind of fast. And I said to him, are you going to test me on the way home? Is this a test? And he's like, no, I'm always just going to drive like normal. And then I closed my eyes. I pictured myself back in the cosmos. My body relaxed in this deep state, and all I could remember was, this doesn't matter. This is nothing. And it was nothing all the way home. I don't know that we have had such a peaceful trip in the car in such a long time. And my body, and I remember telling you, I talked to him the entire way home, which I
Chatted.
never talk because I'm always in this state
Fear.
of vigilance.
Yep.
Yes, and fear. I No, my body was, I had nothing to be vigilant about. So we chatted the entire way home, which was very unusual. He was like, well, this was enjoyable. He was like, I can't remember when you've been so relaxed. And I was like, whoo, just took myself right back there. So, like you said, it's time to probably do another journey because I'm in the window
Yeah.
of resetting my brain.
Mm-hmm.
And yes, and by the way, Ron's reset was incredible.
Mm-hmm.
He achieved his intention. He has reset. Oh, so visible to see. It was wild. The two of us, of course, he's never done a psychedelic either. But he was so open to wanting healing for what his intention was. And it was like, wow. It was a wow. It was a wow at
Yeah.
our ages that, you don't know. You don't know. Is this going to be, difficult? And he was like, all the anxiety he felt beforehand. Oh my gosh, he was so calm and so relaxed and so at ease. It's easy to get back. We're in this window, you
Mm-hmm.
said. So
Mm-hmm.
window of resetting the
Yeah,
brains.
there's like this beautiful like dump of neuroplasticity that your brain gets for the next 7 to 14 days. So
Yes.
it makes it easy to kind of your brain's it's like your brain is really like warmed up clay, so it's much easier to be molded at that time.
Yeah.
And then that's why the integration and you practicing in this window of time makes it really good because it starts to make it stick. But like y'all have been doing this for like 7 decades. It's a long time. That other pathway is pretty
Yeah.
strong. And so,
Yeah.
there's no like magic pill one and done. Like it takes time to create a new habit. So generally, like
Yeah.
you might do another dose in like 2 to 3 weeks and like
Mm-hmm.
allow yourself to really strengthen that new pathway of like, yeah, why don't this isn't a big deal. I'm like, there's nothing to fear. I feel really safe. I can like and really hone in on that one.
And I didn't tell Ron this, but I'll share this on the air. When I first got in the car with him, I kept thinking to myself, oh my God, I wouldn't even kind of mind if he went fast. It was so fun being the wolf and just
You
going
didn't
so
tell, yeah,
fast.
you didn't tell him
I
that.
didn't tell
Yeah,
him
yeah.
that because I didn't really want him to go there. But I remember thinking, oh, I don't know. I could kind of be okay with going fast. Like it was fun. It was fun. Oh, have I ever felt that?
That's like night
Not
and day.
night and day.
Wow.
Night and day. Yeah. So wonderful experience.
Yeah, I
I'm
mean
looking,
that.
yeah.
Yeah, well, and you'll feel if it starts to if you start to forget about the wolf or the fear comes in, and another journey
Hmm.
would kind of go into a different layer. It wouldn't be the same, but there'd be a different layer unfolded, which would be really interesting to check out.
Well, that's why it's interesting listening to you say everyone is so different. And then listening to how Dr. Eric explained the neuroplasticity. It's fascinating to me. So fascinating that I'm going to get training now
Yeah,
to do the
she loves it.
ketamine assisted psychotherapy. I haven't been this interested in anything since doing the past life regression. So
Cool.
here we go, Sarah. Here's like the perpetual learner and then teacher that I love to be, right?
Yeah,
Yeah. So thank you so much for bringing this to me.
you're welcome. I love
So
it.
much.
Calmer car ride. That's like a beautiful thing to have. It's like a daily thing.
Yes.
Mhm.
So interesting.
Yeah.
So
Cool.
I'm excited. Yeah. Yeah. Yeah.
Well, let's roll into the interview with Dr. Eric. And before we do that, we'll hear from our advertiser, Dr. Bethany Paget of Wholehearted Holistic Solutions. All right. Welcome, Dr. Eric Milbrandt. We are so happy to have you on the podcast. It was so great when you and mom and I all got to actually meet in person when we did the ketamine panel at Center Street. And so that conversation was so transformational for everybody who attended. I think it was like 40 or 50 people there. And so it was like, yes, let's have you on the podcast and keep this conversation going so more people can hear what you're doing, what this work is, and the way you share is so beautiful. So thank you for joining us today.
That's my pleasure. Just excited to be here, excited to get the word out. Definitely enjoyed the last time we worked together with the gathering, the panel discussion. So let's carry on.
Yeah, because I know that, my husband and I attended the panel too, and you all are a wealth of information here. So, to start you out in our new season on the podcast as our first guest, we are super excited for the new season. So, thank you so
Well,
much for
thank you.
joining. Yeah.
So, just to kind of get a little background on you, really curious about how you got into the work and how you became, got into ketamine therapy.
So I originally trained to be an intensive care unit doctor, and I did
Yeah.
that for 16 years. Loved it at the beginning. It was my passion, and by the end, I couldn't stand it anymore. I just really got burnt out. And so I was
Mm.
looking for something different. I came across this idea that people were using IV ketamine to help folks with treatment-resistant mood disorders. And I had already worked with ketamine in the hospital for painful procedures. It's an anesthetic, which we'll talk about. But just kind of a light went off, and I thought, I could do this. I care very much about mental health. Had my own struggles with that, so I kind of understood that part as well, and so took the training that I needed to. And in January of 2019, we opened up and started doing IV ketamine. I found out very quickly that it's not just about the medicine; it's about the therapy piece as well, because ketamine really opens folks up. And so went out and did some additional trauma training to learn how do people cope with their trauma as it emerges and as we process it using
And not just
ketamine.
small. That was a year-long training.
Yeah. I was really
Wait,
fortunate.
I don't know
Uh,
many doctors who go into a year-long trauma training when they realize
uh,
patients are coming in with trauma. Like, this is what also sets
uh,
you apart.
Well, thank you.
Yeah.
Yeah, it wasn't completely altruistic. I mean, it was an experiential program, so you
Yeah.
learned through doing. So I got to heal a lot of my own trauma that way
Hmm.
too, and just really fortunate to have had that experience. So, got interested in collaborating with therapists along the way. Figuring it'd be a much better way to help more people, and really have enjoyed that aspect. Therapists who were doing CAP are just a really fun, interesting group to work with. So that's kind of it in a nutshell. There's more
Yeah.
to it, but that's the basics.
Oh, it's a good background for it, isn't it? So I'd love to start off just if you could share maybe a story or two that would illustrate the power of the ketamine therapy. Of course, all confidential, but I'm sure you have some fascinating stories, or Sarah may as well. Could you share a couple of those?
It's hard to pick just one because there are so many, truly. We've been doing this almost 6 years. No, it's been 6 years. Yeah. So it was 6 years
Mhm.
just in January. And, the biggest things, folks who are really down in the pit of despair with depression or PTSD, maybe some anxiety thrown in as well. Um, when they come through the door, it's usually pretty obvious. They have trouble making eye contact, maybe looking at the ground. There's a paucity of verbal responses. I mean, they've had life sucked out of them. And,
Mm.
ketamine works in 80% of treatment resistant cases. I mean, it works and it works fast. And so within a few treatments, IV, the folks that are responders, you can see it when they come back in the door. They're looking you in the eye. They're actually greeting you. They're excited to tell you about what they did over the weekend. They are back to doing their hobbies, maybe back engaged with work. It's just really cool to see that transformation. There aren't many things in medicine that we do that have that quick of a response, and certainly not in the cycle, certainly not with psychology or psychiatry. The traditional antidepressants, anti-anxiety meds, take weeks to months to work. And here we're talking something days to weeks, which is just, it's really fun to watch the transformation. It's like watching a butterfly emerge. It's kind of like that. Um,
Yeah.
and there's just been so many that it's really hard to pick a specific case. The other cool thing that I've seen is folks who come in for their mood disorders, but they're also struggling with unhealthy substance use, be it alcohol or drugs or something else. Oftentimes that gets better too. And it becomes pretty obvious in retrospect, people were self-medicating. They just were using
Mhm.
a substance which wasn't really that helpful, but they were doing the best they
Mhm.
could.
Mhm.
So those are the two main types of transformations we've seen. There's obviously quite a lot of bit of resolving trauma and other things, but I think we'll get into that more here as the podcast progresses.
Yeah.
Mm.
And I think to add on, I mean, we will get into this later, but a lot of people do come in with there's an addiction component. And so seeing that transformation of letting go of the addiction, finding this route to self-love, no more needing to numb,
Mm-hmm.
being able to feel really steady about moving forward without those other substances that blocked them.
Mm-hmm.
The other piece that has been really interesting is we know that the body can hold a lot of pain, and I've seen that be a really interesting result of people with pain in their low back, if it's like financial fears, if it's in the hip, if there's grief,
Mm-hmm.
that being able to notice the pain might have like some kind of emotional component. And when they're on their journey, the medicine is allowing this like door to open to the subconscious where now they're able to find that moment of grief that was able to relieve this clarity that comes through that then results in she had her pain resolve.
Absolutely. Or,
Yeah.
or the constriction people feel in their throat, the
Mm-hmm.
migraines, the bands around the head, other
Yeah.
manifestations, physical manifestations of their psychologic pain.
Yeah, and even people
Mm.
getting better mobility back in their body. There's just all these layered components of when you heal these emotional pieces, a lot of other things that were physically binding you to, your body now get to release because the nervous system is regulated. You feel so much more open.
Mm, absolutely.
Yeah.
Mm. No, interesting stories. I love the stories. I
Yeah.
just because of the studies that have been done, and you see the shift so immediately from from you all being on the panel and talking about it. It's just mind-boggling because, like you said, Dr. Eric, I mean, addiction and PTSD. My gosh, how many years and years and years can people sit in therapy for? It's just amazing. The studies, they they fascinate me. They absolutely fascinate me.
Well, and what's interesting, what came out of my own, work that I shared before this is that I started to become really, I started looking forward to my trauma work. I
Mm.
use ketamine for my own healing, and it's what a shift to be really like positive to go into this journey to heal parts of myself that were so heavy for me to work on before in old types of therapies, that it was like, okay, let me go do this trauma work, let me go clear this out. But in ketamine assisted psychotherapy, there's this lightness to it,
Mm,
that it feels very
Mm.
gentle to move towards it, that it feels very safe in the way it reconciles in the mind. And that, me as a trauma therapist, that has been transformational for myself. And then to see how that my clients can have that journey too, because it doesn't have to be this like painful, awful thing to heal
mm,
your trauma.
Mm.
There can be a different side to it.
yeah. Yeah.
Um,
That post-traumatic growth that
yeah.
that
Oh,
folks talk about. Yeah.
Yeah.
oh, I love that.
It doesn't get enough press, truly.
Oh,
I mean,
I
we hear
love
about
that.
the PTSD, but we don't hear about when people actually transform and transmute their trauma and actually grow because of it, and it becomes a source of strength rather than this thing that defines and holds them down.
Yeah.
Mm.
Post traumatic growth. That's
Fascinating.
it.
Yeah, I didn't come
Yeah.
up with it,
I
I
know.
but
love that.
it's a great term because it's a
Yeah.
real thing. I
It's
mean, those
real.
of us that have walked through our pain, now that is often a source of strength in order
Yeah.
to help others.
Yeah.
Oh, interesting.
Well, let's back up a second and let's talk
Yeah.
about what ketamine is. So, if you would kind of give a little overview of what is ketamine, and a lot of people know it as an anesthetic, but then how did it start to transition into this tool for healing mental health, different kind of disorders and different kind of treatments?
Absolutely. Well, people who have maybe heard a little bit about ketamine, there's all kinds of information and false information out there. Yeah, yeah. They talk about being a horse tranquilizer, a cat tranquilizer. Yes, it is used in veterinary medicine, but it's also used in human medicine, like a lot of medicines that we have. So, it's in the club rave scene. It's called Special K, or there's some other words too. Um, any substance obviously can be used and for good or for not so good. So with that context, ketamine itself is an anesthetic. It's been around since the late 60s. It's called a dissociative anesthetic, which is very different than any of the other anesthetics that are used. It's, in essence, kind of separates your mind from your body for a period of time. And so there's a kind of stepping away. And when it's used to help with painful procedures, the pain is still there, but you don't identify it as being kind of part of you. You almost see it from a third person point of view. So really good if you're trying to, put a dislocated arm back in the socket, definitely.
True.
So really helpful in the battlefield because it doesn't drop people's blood pressure. It doesn't make them stop breathing where a lot of the other anesthetic agents do. So, fast forward to about 20, 30 years ago, people started noticing that when it was used as an anesthetic for big surgical cases like cardiothoracic surgery, bypass surgery, that people's mood was better after the surgery. I'm not sure who originally noticed that, but it was
Mm.
enough that it led to some initial studies and then some bigger studies, and now quite a few very large studies, which have gone on to show that using a specific treatment protocol of IV ketamine gives rapid relief for depression, anxiety, and PTSD when nothing else has worked. Not all the traditional, Prozac, Paxil, Zoloft, run down the list. People that just haven't gotten benefit from those medicines, or they can't tolerate the side effects. So in 2017, the American Psychiatric Association came out with an official position paper that said, yeah, this is legit. We have enough evidence. This is how we should do it. This is the way forward. And since then, there's just been more things in terms of not just using IV therapy strictly as a medicine, but actually using other forms of ketamine as a catalyst for therapy.
Hmm.
Which isn't even
Um,
that long ago, right? 2017 is.
Right. Well, doctors are slow to change. I mean, we're a pretty conservative bunch generally, present company excluded. But yeah, we're careful because we need to be. We need to make
Yeah.
sure we're not doing things to people that, even for short-term gain, it lead to a long-term harm. So that's why it took so long.
Mm-hmm.
Mm. And I'm also curious, Dr. Erk, so what have you noticed? So if people have been on antidepressants, let's say for years and years and years, and they do this ketamine journey with the therapist, is there another effect that happens with that? Is that fine if they're on antidepressants? Do they need to go off of it first? Can you say something about that?
That's a great question. So, mercifully, ketamine doesn't have a whole lot of drug-drug interactions.
Oh.
So you don't need to wean off any of your psychiatric medications before you undergo a ketamine treatment
Mm.
regimen, whether it's IV or ketamine-assisted psychotherapy. There are a few medicines which tend to kind of block the effect. The benzodiazepines are a common thing. Also, Lamictal and Trileptal, to a certain extent, gabapentin. For folks that are able to, we usually beforehand would just have them hold the dose right before their session. They don't have to
Mm.
completely wean off. They just skip a dose basically, and that seems to do the trick.
Oh, and that's determined. So when you meet with the doctor to go through that interview process before you get the medication, that's when all of that would come out for the
Exactly.
client then. Oh,
And
okay.
and
Yeah,
then
that's interesting.
assuming people have had a good response, I mean, the ultimate goal is to help them to wean off of those medicines because they
Yes.
obviously weren't really helping anyway, and many of them have very bothersome side effects. And so, over time, weaning off of those medications so that people can be their best self without, being impaired or having intolerable side effects.
And I've
And
seen a
then
lot
do
of
you, oh,
clients who have come through where that is part of their goal is to get off their SSRIs because when they've done it in the past, it's been very overwhelming. They
Mm-hmm.
didn't have any support
Mm-hmm.
either therapeutically or medicinally. And so when working with ketamine, right, you can do that side by side while you are on these SSRIs and start to decrease those prescriptions
Absolutely.
while you're in CAP,
Mm-hmm.
and that really helps to stabilize because you're also
and
getting to the
yeah.
root.
And do you
Uh,
find the psychiatrists are receptive to that when they're working with their patients and they have had these? I mean,
Some.
what's
It's
happening with that?
well, when I first started this, 6 years ago, absolutely not. So few people, at least in the area where I'm working here in North Central Florida, nobody was aware of it. So a huge part of what we were doing was just outreach and education. Now it's become much more mainstream. There are still
Hmm.
people that fall into the category that they think, it's just too dangerous, too risky, whatever. But there are a lot more folks now that recognize it as the catalyst for healing that it is. And so we get lots of referrals from psychiatrists to kind of
Oh, nice.
co-manage, and so we
Yeah.
don't necessarily take over or steal the client. We help them. We
Collaborate.
stay in communication and help them work towards whatever goals that the patient has.
Oh, I love that. Progress.
Absolutely.
Progress.
Like I said, docs are slow to change, but it's happening, thankfully.
Yeah, and more patients are advocating for this, and
Hmm.
so
Yeah.
that's one of the biggest benefits too.
So I
Agreed.
hear you and Sarah always talking about how ketamine is described as this brain reset. Can you explain how it actually affects the neuroplasticity and what does that mean for our healing? I mean, how does it help the brain form all these new connections?
Mhm. So, neuroplasticity is this idea that our brain can change over time based on stimuli. So, experiences, medications, other things change the brain over time. Can cause it to form new connections, to break down old ones that are not useful anymore. A good example of this is someone who plays the piano. It begins playing the piano, plays it over time. You can actually see changes in the brain on functional MRI studies that show areas of the brain that are responsible for that kind of manual dexterity and music. You can see those areas actually grow in size. So there's definitely a kind of a physical biochemical change that happens. How this occurs, at least specifically with ketamine, is through its interaction with something called the NMDA glutamate receptor. So it is unique as opposed to most of the antidepressants either work through serotonin, norepinephrine, or dopamine. This works through this glutamate receptor. It inhibits the receptor. There's a whole bunch of downstream effects that happen because of that, but ultimately what happens is it causes the brain to release something called BDNF. It's brain derived neurotrophic factor. It's kind of like fertilizer for the brain.
Mm.
And if you look at studies in rodents where they're given a dose of ketamine and they look at their synaptic connections, you got to slice up the brain and look at it under a microscope. But within hours, you start to see new connections forming between between the nerves in the brain. We grow what we call synapses. That's the term for connection.
Hmm.
And you begin to see these bud off of the neurons in the front part of the brain, which is the part of the brain that's responsible for both executive function as well as modulating emotion. If you look at folks who have significant depression, anxiety, PTSD, that front part of the brain, they've lost connections up there. It's not that the brain has died or anything like that. It's just that the connections, for whatever reason, they've just kind of fallen away, much like a plant that doesn't get enough fertilizer.
Mm-hmm.
So you've got this BDNF. It allows you to kind of make some new connections. It allows you maybe to break down some ones you don't need anymore. And so this allows you to have this neuroplastic state where you can get out of the ruts that you're stuck in, uh, and form new pathways for change.
There was
Mm.
this really cool study when I was doing my training where it showed, a healthy neuron with its dendrites and synapses that looks like this, a fall tree that has just all its leaves. It's really colorful, it's vibrant. And that with 3 weeks of chronic stress, emotional, physical, whatever it is, that tree just dwindles down to this winter small tree. Branches are really small. And so people, when they get into these depressive states, it's not just they're lazy, there's no willpower. It's that they literally don't have the structure to support to see these new thoughts, and you just get stuck in that same loop. And you feel that, you can hear it in people when they're in these anxious spirals or depressive spirals. And then it showed in the study when people take a dose of the medicine that they have this window of time where it just grows back. And
Mm.
you feel that, you see it, that people are like, oh, I couldn't see that before. And so there's kind of two parts of their having this new, awareness and this new kind of level of motivation to also engage in new behaviors. So now they are actually doing these non-depressive activities. They're going outside, they're connecting with friends. This combo effect of new thoughts and new behaviors allows them to really
Absolutely.
integrate and move forward and create that new pathway.
And that piece about, there's the medicine effect and then there's the behaviors. The medicine gets it to the point where people are able to start doing the behaviors that make them happy in the first place.
Yeah.
Connecting with others, hobbies, professional things, just self-care. When you're really down in the pit of despair, you just can't do those things, and so that makes everything worse. We're meant to be connected with others, and when those connections are severed, we suffer.
So it's almost a remembering effect of
Right.
Yeah, of remembering, and but also a newness as well.
yeah.
Yeah. There's this
Interesting.
really good metaphor that a lot of people talk about is, we're Floridians, so I know not all of us ski, but as imagine are on a mountain skiing, and everybody's going down the same slope. These are neural pathways that we have defaulted to over our decades of our life. The whole time it's easy, we know how to do it. Okay, this is what I do, and it's nice to just default. Conserves our energy. That's a really nice thing to just have that, but sometimes it becomes destructive. So what it does is it allows this new pathway to open up, but this one hasn't been taken. Right, it's through the woods, there's no clear path, there's rocks, there's bumps. It's hard at first until you take it and it smooths over and over, and that's what it starts to do. And what I really love about this neuroplasticity idea is that as you start to take this new path over and over again, not only does that get stronger and easier, but the old way atrophies and dies off. That's how
Absolutely.
you can literally rewire and change your mind. We're not stuck to the old pathways anymore.
And that just gives so much hope.
Yeah.
There was this concept that once your brain is how it is, it just sort of stays that way and it doesn't change. It only gets worse over time. And I'm really glad to know that's not the case.
Yeah. Because people come in and they say, I'm broken and there's nothing I
Oh.
can do. They have that rooted belief in there. It's like,
Mm-hmm.
that was an old concept. That was old research. And we have such new understanding around it, which is incredible hope.
Yeah. Fascinating. I love that metaphor. The skiing one. That's good.
Yeah. Helpful.
Yeah. Yeah. Very helpful. Yeah.
So let's kind of move into some of the mental health conditions that we really see people coming in for. What are the main ones that ketamine is being used to treat for? And is there anything that people wouldn't, if they have this kind of mental health condition, that ketamine would not be a good tool for them?
So the main things that have been studied the most are kind of the triad of depression, anxiety, and PTSD. And so often those things are all wrapped up together. People have varying degrees of each one. If you've lived in life, you have some trauma. Some people deal with it much better than others. But those are the main three. Now, there's a whole host of other things that it is being used for: obsessive compulsive disorder, eating disorders, addictions. Um, it's not quite as effective as someone say that maybe has borderline personality disorder. If that's really what they have, although so many people in that condition are misdiagnosed, and it's really their complex trauma that has made them so reactive. And so if someone comes to me with that diagnosis, I really take that with a grain of salt because people get mislabeled all the time. Bipolar disorder is one you do have to have a little bit of caution. If someone's in a depressive phase, then of course it's not an issue. You can help bring them up kind of to midline. If they're in a manic phase, you would not want to use it because that could make the mania worse. I've used it in a number of more severe bipolars, what we call type 1. And, the concern was that, we're going to flip them into a manic phase. And I have seen that happen twice. Both times, people were also taking psychedelic mushrooms. They were microdosing mushrooms, which is a really common thing these days. Many people have heard of that. And so there were two things that were pressing down the gas towards mania at the same time. And so when we backed off on those and when they stopped microdosing or when we reduced the dose of ketamine, they came back down into exactly where they needed to be. So that's just one area to be cautious. People who are really high controlling, don't like roller coasters, don't like feeling out of control.
They definitely
Sometimes,
need it.
well, yes, but you do have to kind of start low and go
Right.
slow.
Yeah.
You don't want to throw them into the deep end with a
1,000,000%.
big,
Yeah.
huge psychedelic experience
Yeah.
because they're, if they've never been down that path before, it can be scary. And so you just want to, proceed with caution with folks, but they're really, you know, psychiatric conditions, there just aren't any that are a major contraindication. Even people with dissociative identity disorder, even they can actually work with this. It
Really?
doesn't put them
Really?
in a permanent
Oh.
state of dissociation. In fact, most people who have that issue are very comfortable moving in and out of different
Mm-hmm.
Hmm.
um, levels of cognition. Now, there are some things from a physical standpoint, medical illnesses that would be pause for cause. Cause for pause. Pause for cause would be for pets, I think.
Yeah.
But unstable heart issues. So someone has chest pain with exertion, they've got blockages, they're not well controlled. If they, have major heart arrhythmias that are constantly going on, that would not be a good patient. Ketamine itself raises your blood pressure maybe 10 points and your heart rate maybe 10 points. Which is not a big deal for most folks, but if you're already kind of living on the margin, putting some extra stress on your cardiovascular system wouldn't be good. The blood pressure at baseline should be well controlled. So if someone has high blood pressure, that's fine as long as they're on medication and it's controlled. If someone instead their blood pressure isn't controlled and at baseline they're running 180 over 100, you want to get that blood pressure under better control first, just to avoid it going too high during a session.
Hmm. That's interesting.
Those
So
are
as
the, I was going
I,
to say, those are the main physical. There are a few other things. Pregnancy, you don't want to do it during pregnancy.
mm,
If their thyroid is way high, you want to get that under control first.
mm.
Those are kind of the main things.
So, and as I've shared some of this information about ketamine, one of the questions that comes up so frequently from so many people is what about those in the active addiction stage? So they have been an alcoholic for years. And what does the detox look like? How does the ketamine affect this? What happens to them? And this question has come up a lot with my clients. Can you explain that one?
Also, a really good question. People who work in the addiction medicine field were concerned when they initially started hearing about this. It's a mind-altering drug. Some people abuse it. We're just going to make their addiction worse, or if they're in recovery, we're going to reactivate their addiction because they're going to be high.
Mm-hmm.
In practice, that's not the case. Now, the one exception to that, if someone ketamine was their drug of choice, which in
Mm-hmm.
most people who have experimented with substances, usually that's not the case. Usually there's some other drug that's their primary drug of choice, and they have dabbled in ketamine a little here and there, often at parties, raves, things like that. But I have met a few people, it was their primary drug of choice, and there definitely are people out there where that's a real danger for them. And so if they have that kind of history, that's someone you probably would not want to use ketamine with. Now,
Mm-hmm.
all the other classic addictions, alcohol, cannabis, cocaine, amphetamines,
Mm-hmm.
opioids, benzodiazepines, they don't work in the same brain receptors as ketamine. So you're not going to like tweak that opioid receptor in someone who hasn't had opioids in a while and make them run off to the dope house to, get oxycodone or something like that. Um, what I have seen over and over is that people who come in for their mood disorder and they maybe have unhealthy substance use, they either develop a healthier use pattern with that or they stop altogether.
Mm-hmm.
Now, if you have someone that, they drink so much alcohol a day, they're drinking a half gallon a day or something around that, you do
Mm-hmm.
need to have them medically detoxed first because just like stopping
Oh.
alcohol all of a sudden.
Your
Now,
system can't
that
handle
being
it.
said, I have lots of folks come in that are actively drinking and I don't force them to detox before they start using ketamine, but I do advise them like, hey, if you're feeling good, don't just quit suddenly. Make sure that you're working with
Mm-hmm.
me or working with your doctor as you begin to wean off or stop this. Same thing with benzodiazepines. Those are kind of the two things that are dangerous to stop suddenly if you're taking a fair amount of either of those. The rest of the medicines, rest of the drugs, not really an issue. People might feel bad when they're withdrawing from it, but they aren't dangerous medically.
Mm-hmm.
Hmm. Interesting. Yeah. That question is A lot of addiction issues around, right? Yeah.
Yeah,
Yeah, I think it
Yeah.
just needs a lot of education, but it is a big population is coming to me for that purpose. A lot of my clients are
Yeah.
finding that psychedelics and even this non-classical way is a great tool to get away from substances that are causing so much harm because you're rewiring that relationship.
absolutely.
And
When
it's
you
not
deal,
addictive. It's not an addictive
yeah,
substance.
yeah, not in the classic sense. It
Right.
doesn't tweak dopamine, which is kind of the main
Mm-hmm.
underlying thing that most highly addictive chemicals do. That being said, I mean, it can become a problem for some folks. And so, using under medical supervision, having a lot of accountability and oversight, very important keys to it.
Yes.
And there's been some very high profile cases, one in particular with an actor, Matthew Perry,
Mm-hmm.
Mm.
from Friends, tragic case. He was not under medical supervision. He was buying illicit ketamine. There was somebody selling him bottles of the
Mm.
stuff.
Mm.
He, unfortunately, when he died, he did have a lot of ketamine in his system, way more than you would ever medically use. There were some other substances in his system too. Ketamine itself, even at high doses, generally isn't going to kill you, as long as you're not someplace where if you kind of nod off or are semi-conscious, you're going to get hurt. So, hot tub, terrible place to be, and unfortunately, that's where he was. And and
Yeah.
and, and I, gosh, it's just a real loss. I mean, he's a really talented guy, but he obviously was a tortured soul.
Mm. Yeah, and then the follow-up question, Dr. Eric, that I get from the initial I just asked is, so if there is a shift from the ketamine assisted psychotherapy with the addiction, is it still necessary to go to rehab, 12-step programs? What would be the follow-up? Does there need to be a follow-up to that? Do you have any insights to that?
Oh, you're. This is one of the issues I'm very passionate about.
Oh,
I'm in
okay.
recovery as well. It's been about 8 years,
Okay.
Mm.
and so I could definitely speak to this.
Yeah.
I've also worked with ketamine. I have a provider that helps me with that, and so traditional treatment programs, the 30-day programs or longer,
Mm-hmm.
work. People have about 10% long-term sobriety, as defined by abstinence from whatever their substance of choice was. 10%. The other
Mm.
90% have some form of relapse, whatever that looks like. It might be
Wow.
minor, it might be major, but they don't get what they were looking for. And
Mm.
so this has been the treatment paradigm for decades. Uh, it is abstinence based, which many people just can't do or they're not able to do where they're at.
Mm-hmm.
Mm-hmm.
And I'm very much a believer in something called harm reduction. Not the person who came up with it. It's been around for a while, but it really in the last 5, 10 years is gaining some traction in the treatment world. And it is the idea that not everyone can stop completely. Those that aren't able to or don't choose to, we can find ways to reduce the harm that is occurring because of their substance use or other
Mm.
behaviors. So, a non drug example of this is seat belts. We force people to use seat belts. Why do we do that? We want to reduce the harm of driving.
Mm.
Condoms, another great example. If
Mm-hmm.
using a condom reduces the risk of sexual behavior and sexual encounters, it is a harm reduction technique.
Yeah.
Uh, Lots of other examples of that. Sunscreen, for instance,
Mm-hmm.
reduces the harm of being out in the sun. People are going to go out in the sun anyway. Why not? Why don't we just make it safer? And
Mm-hmm.
so, with substances, the goal in harm reduction is to work with the patient towards their goals. Not my agenda,
Mm.
not what I think sobriety should look like for them, not what I think they should be doing, but to figure out what do they actually want to work on? What part of their life do they need help with? What are they willing to do right now? And then working with them towards that goal. And so ketamine can be an important piece of that, particularly if you're
Mm.
addressing the underlying issues. People who have trouble with alcohol, drugs, behaviors, to the point that's actually causing dysfunction in their life, it's not the substance itself, it's what they're trying to treat.
Mhm.
And so if you can get under the hood and get or into the subconscious or however you want to put it, if you can get to that key issue or issues and work on those, the drive to
Mhm.
drink or drug or do harmful behaviors lessens. That's harm reduction.
Yeah.
Maybe
Mm.
it goes away completely, or maybe it doesn't. Maybe it goes from someone who drinks every night and passes out to someone who has a drink every now and then and actually can sort of drink responsibly again. Um, that idea in the AA world or the classic treatment world,
I
that is
know.
that is like
No, no. Yeah.
blasphemous.
Yeah.
Someone
Yeah.
could drink healthy again, or someone could use cannabis healthy again,
Right.
or any of those.
Mm.
But it really can't happen. Ketamine isn't a magic wand. It's a catalyst. It's a tool to be used to deal with the underlying issues. Once those issues are addressed, people often get better.
I think
Mm.
there's a part that you are speaking to, which is integration,
Mm,
because the ketamine is a tool. It's medicine. It works. Like we know, you if people are arriving in the hospital and they're suicidal, you give them ketamine, they feel better. And it is medicine that works just on its own. But in this model that we work with in the assisted psychotherapy, it's not just about taking the medicine, it's about what happens next. Because some people they dose and they feel the effects that are benefit, but then they have to do it again and again and again and again, but because they're not making the habit changes in their life. And
mhm,
so in the integration process, when you start to look at, which some people have, some people do programs because it's just those daily reminders. There are different steps, but that can look right. It's not based on what I think is your integration tool. We collaborate to figure out, okay, what does integration look like? Is it daily gratitude? Is it journaling? Is it connecting with somebody? Is it accountability? Is it movement? Is it art? Is it creation? What are
mm,
those micro changes that now it's just like if you're on a ship, the ship doesn't make this 90-degree turn, right? It's these 1-degree turns that then that sets the pathway off where now, after some time, you are a totally different person through
mm.
these little micro changes that you've created.
Agreed.
But without the integration, the medicine will only there's about with ketamine generally there's like a 7 to 14 day lasting period of you have this window where you have neuroplasticity and all the that brain fertilizer, that BDNF protein is in there and ripe, and then it starts to fade off.
Mm,
And so in that window, once if you harness that, if you're taking that new pathway, the new slope over and over again, well, you're making these changes and seeing it in a different way of like, maybe I don't need that drink today. Okay, I don't need that. I'm gonna have time with a friend instead, and find connection, because that's all I really wanted was,
mm,
what is that substance giving to you? Is it relaxation? Is it connection? Is it play?
mm,
And if you swap that in there through just mindfulness, well, I don't need that substance because I was able to have fun and laugh anyways. I was doing that. That's what I was really seeking.
mm. Exactly.
Mhm.
Yeah.
And there's a spectrum there. Some
Mhm.
people are not ready or willing to do the work,
Yeah.
and that's okay. We can help
Yeah.
them feel better. Hopefully, by doing
Totally.
so, they're actually willing to do the work. But and that's that same harm reduction idea. We can reduce the harm that the depression is causing by helping to lift their mood. But if we can then enable them to do the work, that's what brings the lasting change.
Mm. So interesting. It's fascinating to me. So, how about this question? So, we know ketamine doesn't just affect the mood, it has this powerful impact on the nervous system. How does it actually help regulate the autonomic nervous system and just shift people out of this chronic stress state, fight or flight, and creates a sense of safety that I hear you both speak of so much in the body? How does it do that?
Well, there's a couple different ways. One is that we talked about forming those new synaptic connections. So you strengthen this part of the brain called the prefrontal cortex, and that allows you to help modulate the more primitive lizard part of the brain, the hypothalamus, some other areas that are very central in the middle part of the brain. It's a very primitive part of the brain that's responsible for eating, for protection, very strongly active in fear and anxiety, for procreation. It's a very essential part of our brain, but it can get out of control in trying to keep us safe. And so if you can help that prefrontal cortex work better to interact better with that more insular inside part of your brain, that's helpful. Um, there's this metaphysical aspect of dissociation, of stepping away from your body for a little while, of seeing your problems from a different point of view. And that in and of itself can often hit a reset, especially
Mm.
under the influence of the medicine. Things that were really bothering you, you can kind of look at and say, I see that it's an issue, but like, it's just not that big of a deal. It's so you
Mhm.
just like the same thing you were looking at before, just you see from a slightly different angle. And that can allow you to really kind of step down from the adrenaline, from the cortisol, from all the stuff that you're
Mhm.
running around in this you know jacked up state that's just totally unhealthy for your body and for your mind. So those are a couple of ways. There's
Mm.
obviously more to it, processing the underlying trauma, other things, the stuff that your body is holding on to. Same idea. It allows you to just take that foot off the pedal, allow you to be in a much healthier balance between your autonomic, parasympathetic, sympathetic, and sympathetic nervous system. Uh, yeah.
Mm.
Yeah, it's deeply nourishing to the nervous system. And one of my favorite things when guiding clients is while, there's that 15-minute window and clients are switching the medicine and it's starting to kick in. And always during that window, as it's starting to arrive, you see these big breaths and they just start sinking in. So a lot of people start to feel this really, I always say it's like my best state of when I'm in hypnosis and a weighted blanket on me, and it just feels so good to be in this space. You just feel
Mhm.
your body relaxing in a way that you've been really craving and didn't know you needed it. And it just softens the part of you and it nourishes
Mm.
within there.
Yeah.
Well put. Well put.
Sarah, I'm curious because obviously, you do the hypnosis as well. How does it feel similar or different to you in the state?
So, similar to hypnosis, I am in my subconscious and my conscious mind is there. I know that I am in the space, that there's someone guiding me, that I am safe. If I, you know, needed to say something, I probably could. With ketamine, it's a little bit different than hypnosis because your body is, it's more of an anesthetic. So during the journey session, you don't move as much. Well, some people do move. Some people move more or less, and that is very
Mm.
dependent on self. Um, but it is that same space where you have your subconscious mind is so open, and some people have visuals, some people don't, some people have felt experiences. Every journey will look different even to the same person.
Mm.
Nothing, they're all snowflakes. But what's also interesting is that there is this in hypnosis, the conscious mind is actually 2 to 3 more times alert, and so you do have this
Mhm.
ability to make quicker connections that are going on, and that
Mm.
while you're witnessing it. So that's what's really interesting is there is these deeper almost ahas or curiosity, and sometimes they come out in the journey, sometimes they come out in integration, sometimes it lands, you know days or weeks later that it starts to click. And so it's kind of big
Mm.
part of psychedelics is trusting yourself, trusting the process, really being open. I find that the
Mm.
more times people have this deep expectations that it will look or feel or garner this specific result, the more they are disappointed. But when people kind of come at it with this, I'm open, I'm receptive, I'm interested, and you kind of keep this lens really wide, then it invites a space where you're getting answers and maybe not what you want, but what you need.
Absolutely.
Yeah.
Mm. So interesting. Well, I have a question for both of you then. So, why is this period after the ketamine session so important for creating and reinforcing these new neural pathways? Because when you're doing the IV therapy, you're not having that, right, Dr. Eric? As it's different than working with a psychotherapist,
And maybe
right?
before
Those
you
are
go
two
into that, maybe
different things.
share those different routes of administration. Could you
Oh,
kind of talk a little
Yeah.
bit about each one of those?
sure. So a variety of ways to get things into your body.
Mhm.
Classically, you think of an intravenous, an IV injection. Very quick way to get into the body. The levels come up very quickly. You have more or less 100% availability. Um, the drawback, you got to put an IV in. Some people can't stand needles or IVs. My wife is one of those. She hates IVs. Um, just doesn't like it. So other ways to get it in, you can do an intramuscular injection. So you put a needle into the muscle and inject the medicine there. It also is very available that way. It absorbs very quickly. And so with both of those methods, you get a very quick onset of action. The intramuscular, because you're giving that dose all at once, it actually shoots up even faster than the IV does. So very quickly gets people to the point where an IV, you're often kind of trickling it in over time. And so it's a little bit slower onset, but still relatively quickly, 5-10 minutes. Other routes of administration, a very popular one, especially for ketamine assisted therapy, is the sublingual, which means under the tongue route. And to do this, we use a couple of different forms of it. One is called a troche or a troche. It kind of looks like a little now and later, like a little waxy square. Sometimes they come in circles as well. It's designed to melt at body temperature. It goes under the tongue. It has the medicine in it. It melts. You hold it in your mouth for about 15 or 20 minutes. Twist around a little bit while you're there just to kind of evenly mix it, and it absorbs through the lining of your mouth. If you actually swallow the ketamine, like a pill or the troche or anything, it doesn't absorb very well from the stomach. And when it does, it passes through the liver initially, and the liver breaks down a bunch of it. It's called first pass metabolism. So the sublingual route, you actually have much better availability. Approximately 25 to 40% of the dose is available sublingually, where if it was taken orally, maybe 5 or 10% of the dose. So big difference. Uh, Other methods, you can use vaginal suppositories, rectal suppositories. Obviously, they're a little more invasive, not something you maybe want to do in your therapist's office. But hey, you do you, right? Uh, and then there is also a ketamine nasal spray. Um, Very quick onset, and it can be helpful in a session where you maybe need a little booster dose in the middle of the session because maybe your sublingual dose has worn off a little too fast. You just want to supplement it a little bit. Um, the drawback of nasal, it's a little bit drippy, a little bit messy. You don't necessarily get this a predictable dose because maybe someone has some congestion or they've got nasal polyps or other things that make the absorption variable. Similarly, it's just a little harder to keep track of. How much have you taken? Well, I don't know, several sprays. I'm not really sure. The bottles don't have counters typically, and so as opposed to say a package of the troches, the lozenges, they're very easy to count. Oh, one other sublingual form. I talked about the troches. There's also something called a rapidly dissolving tablet. Kind of looks like a Tums. About like that. You put it in the tongue, it also dissolves a little faster than the troche,
It's
absorbs a
like
little bit.
sand. It's just like
Yes, it's just kind of blah.
So it's
It-
faster? It's
a little
faster.
bit faster. It may be 5 or 10 minutes quicker onset. Both of those forms, it's usually about 20 to 30 minutes before you really start to feel the effects. Um, yeah. Oh, I should mention when it's put in the mouth, ketamine is bitter. It just is. The ketamine itself is bitter. It's often flavored with different things, but it's that flavor plus bitter. It's not horrible. Like there are bitter candies out there that are far more bitter. Sour Patch Kids, for instance, love that stuff. But there are a few people that they can't stand the taste. They just can't. And so that can be a challenge. It's pretty uncommon. Again, it's kind of the price of admission. This thing doesn't taste great, but I can do this. It's also a protective factor. If somehow a child would get into the medicine, they would taste it and spit it right out. Like, this is the worst candy I've ever tasted. Like,
Oh,
why
that's
did
so
you give me
true. I
this
didn't
crummy
think
candy,
about that.
mommy?
Interesting. Yeah.
Yeah, yeah.
Yeah.
And so, Mom, you were kind of sharing about that time, right? Like about the window
Right.
of time and why it's so important right after,
Right.
and kind of discussing those different routes. It's part of it's going to kind of look at like set and setting. So a lot of IV and IM is often done clinically.
Mhm.
Right.
And there are some clinics that are set up in a more therapeutic model, but many of my clients who've come to me after doing some IV treatments, that was the part that didn't click for them. It was kind of a more sterile environment. There was a therapist there, but they didn't know them. It was just somebody
Oh.
there if they needed to talk to them. They were
Mm-hmm.
kind of on their own journey and then they left. It was a route to get the medicine, but there wasn't this connection. And so a part of psychedelics is really having trust in the facilitator, having that safe holding, and then also somebody who knows what you're working on and can put the puzzle pieces together is really helpful, because often we can't see through the forest. Like it just looks like so thick, we can't understand what we are trying to see. And so having a facilitator really helps to unravel that.
Mm-hmm.
Um, in a ketamine assisted therapy model, there is so much intention on the set and setting. So you want a very warm and cozy environment where you're being held. There's beautiful things to look at. There is nice smells. There is dim lighting. It is cozy. Your body, right? Everything you can think of that you could just go and just relax. And then mindset is the other one, set. And so what is the intention, right? Where are you going? And sometimes that can get missed in a clinical environment, right? The intention really primes the mind. So as if, every time I get in the car, I put my GPS on, I know where I'm going. And so kind of setting that coordinate of like, where do I want to go? What do I want to achieve? And so that the
Mm.
mind has this pathway to find that. And then afterwards, there's time to connect in that. And some people speak to
Yeah.
having these bad trips, and that's when I find that they're doing it's not in this model because there's so much
Mm.
intention behind it. It's when they are out with friends, somebody has a nasal spray, they're putting it in there, 1, 2, 3, 4, 5. Now I'm in a K-hole. Where that is that relaxed state, but you're out, maybe you're with friends or at someone's house, and it doesn't feel safe. You're not being held or guided. And there are people that come in like, oh, I don't want to do that. Well, of course, that I wouldn't want to do that either. And so it's kind of removing that stigma of, well, if you are really intentional in this way, that medicine is so beautiful. But when used recklessly, people are drinking on it or taking other substances, it doesn't feel good. And you didn't prime the mind. So maybe something came up that you weren't ready or prepared to
Mm.
unpack at that point. And then what kind of integration happened then? Well, you came out of this, you were a little nervous. What just happened? You were anxious with people, they weren't paying attention to you. And so that's where there is no, when done in this way, there is no bad trip.
Mm.
The,
But I'm
And
curious as to the level of healing that occurs, and I don't know if there's been studies done on this or not. If you are in a clinic setting and doing the IV versus the ketamine assisted psychotherapy, because they're just so different because you are doing the integration with them. Have there been studies on the difference of the level of healing?
so no like side by side comparators, really hard study to do because there's so many variables.
yeah.
Oh.
Within the most studied is the IV just medical model that doesn't necessarily include any integration or therapy. I kind of take a hybrid approach myself in our clinic. It's much more like going to a spa. We've got the good smells going in terms of, diffused essential oils. Each of the infusion rooms is private. There's lighting if you need it. So, the
Mm.
door can be closed. You've got a relaxing, reclining chair, typically a nice, snuggly warm blanket, eye mask, good music playing. I have one person that runs all my IVs. He's an amazingly gifted guy. First of all, he's great at starting IVs, which is essential. I mean, because if
Yes.
you've been poked 10
That's true.
times, you're not going to have a good
Yes.
experience.
Yeah.
So he's usually the one shot guy. He gets it. But he's actually also works with the fire department. He's a chaplain in the fire department. He's got a very big heart for people, and so he meets with folks before and
Yeah.
after to help prepare and talk about their experience when folks come back in. He's the one person that they see, so he knows what's going on. We keep very liberal notes in terms of the types of things people reporting, the types of things they're struggling with, so we can make sure we have that continuity. Now, it's not the same as spending an hour or more with a therapist, but again, some people aren't wanting that at this point. Now we
Mm.
also we do offer the option they can work with me as a counselor as in assisted therapy, and so I will meet with people either before or after, or maybe the following day, in order to help process and integrate what they've gone through.
Mm.
Hmm.
Mm. That's interesting. Yeah.
Yeah. So when it's a model that's done so intentionally,
Mm.
Right. I love that in the clinic. That's how you set it up, because that
Mm.
creates those long lasting effects.
Mm.
Um, we are starting a ketamine assisted therapy group. And so in that model, people are also inviting this connection and community in,
Mm.
where it's an in-person journey. They're being guided, same as iMask on this one, because there is a group. We have headphones on as well, so that if people do sometimes talk, like nobody is disturbed. There's mattresses and blankets and good smells, and they get, they're making their own, they're journaling, their own personal little altar, so that they're all prepped in this way. And music is a really important component of the journey. There's no words, but it moves the subconscious in this beautiful way, almost like it's different chapters, different scenes going. A lot of people some people talk about it as like a game, change levels, but it moves you along on the journey. And then in these groups, once people come out, we have a family meal. We eat together, there's some connections, there's some light integration, and then we have a follow-up the next day where we actually have a group integration understanding, so that they can start to integrate and learn from others. There's a
Mm.
big part of this, it's new work for a lot of people. A lot of people, it's their first psychedelic, and you don't know what you don't know. And so being able, oftentimes we're all human, so a lot of the things we're working on are very similar. I'm wanting to trust myself more, or love myself, or find this way to just deepen my you know connection to self or others. There's a lot of very general things that all people are seeking, and
Mm.
so through that also integrates, right? What you focus on expands in the mind. And that's kind of the goal, is if it's in a model where you have this really good attention on what positive shifts you're making, that's what lasts. So it's wherever that can be found, which can be in a lot of different ways. And I think that's why there hasn't been really studies, because they look all so different.
Mm.
I might just piggyback on that. I'm a big believer in group work, whether it's ketamine assisted or not.
Mm-hmm.
We heal in community. We just
Yeah.
do. You know, severe mood disorders, other issues, addictions, they're diseases of isolation. They pull us away from the herd, if you will. We lose connection, lose meaningful connection. And so healing is part of that, is making new connections. Group work
Mm.
is often scary for folks. They're like, oh my gosh, I'm going to bear my problems in front of a
Mm.
group of people I don't know very well.
Mm-hmm.
Well, once you've tried group therapy and been in a good group with a safe container,
Yeah.
um, that is addictive.
Yeah.
But it's a good kind of
A
addiction. It's
good addiction.
connection with
Yeah.
others. You find out you're not alone in your suffering. There are other people that maybe have been through similar things, or maybe different things, but it's something you can still understand, and realize that you just
Mm.
aren't alone. And then again, getting that connection is so important. And there's, with the society we're living in now that's hyper connected online, we often don't have true meaningful connections. And
Mm.
so, something like a ketamine assisted group, or even just a regular group, can be
Yeah.
so healing.
There
Well,
was a
that's what we've
talk.
seen from the retreats, Sarah, that we've done in person. I
Yeah.
mean, the shift and the level of connection. And for people that have never done a retreat, they just can't even get over the level of healing they feel. It's
And I
it's
think more
phenomenal.
people are open to it. Certainly, COVID and lockdown and all those, some months, or sometimes for people years, depending on where they were, of isolation.
Mm,
They're, on the other side of that, people are craving these in-person connections.
mm.
Esther Perel, she talks about AI, but as artificial intimacy. That,
Oh, wow.
yeah, she has this
Oh,
Yeah.
whole
isn't
talk
that
about,
interesting?
you're on your phone, you're on social media seeking this, intimacy through the
Mm.
digital world. We're on these, calls, and it's just not satisfying.
Mm,
And so when, on these retreats, and, I attend them, I lead them, but people put their phones away, and there's such rich connection that you feel this fullness that you can't satisfy through online, unfortunately, right? You
mm,
just keep going back and back, seeking more, right? Our phones and social media just pull you back in more and more, hoping that you can get that satisfaction, but you don't.
mm,
And so that's what
Mm.
people are starting to notice in these spaces, that you get this fullness feel, because we are primal. We are a tribe. We were back in the day. We found safety in being a tribe. We heal in community, and just because of our technology, it allowed us to be really independent, but almost to a disadvantage. So I see so many more people going back into community, tribal days, growing their own food. Like, it's like, wait, I think we're getting it wrong a little bit. Let's move back into the space where we are connected.
Mm. So let's share what a typical session would look like from beginning to end, because I think it's really fascinating. And the music is such a pivotal piece of it. But are there people that don't use music with it, or is that a standard piece of the protocol? I'm wondering. Can you both speak
Sarah,
to
how about
that?
you take this one?
Yeah. Well, for one, the music, yes. Music is with any psychedelic, but especially with ketamine, it is one of the prime collaborators in the session. And we've all felt it. If you only had words, if it was only white noise, if it was only quiet, there wouldn't be the same effectiveness. I know there's research going on right now around how pivotal music plays a role in the process of moving you along. Actually, my colleague Pam, who is also running these groups that we all know very well and love, she is doing a capstone on that and doing the research around the role of music.
I might just briefly interrupt. I just out of curiosity did one session myself without any music.
You did. What did you
it was
experience?
okay, but
Yeah.
there was just something missing. And I wish I could describe it better than I need to go back to my notes that I took afterwards, but glad I tried it, but I also think the music needs to be there.
Goes on this wave. And so to back up what it looks like, kind of in the whole process, the first step in the ketamine assisted psychotherapy model is to connect with a therapist who is working in this. So they are trained in ketamine. You would have a session with them, me, Pam, whoever. And upon that, we would refer to Dr. Milbrandt. So you would then have a medical evaluation with Oasis. They would clear you medically. It's usually about like a 30-minute appointment. After that time, you are sent a prescription to your home. And that's what's really cool. It's so safe. The medicine is so safe that it's being sent to your home. After that point, then you would schedule a session together with the therapist, either one-on-one or group, and where you are bringing the medicine either to the office, or I often go to clients' homes for their first one just to set them up in their space, just so they feel comfortable. What's the most safe you feel? Sometimes it's better for them to leave their home, depending on what that looks like. Sometimes it's better for me to go there. Because you don't want to have to drive afterwards. So people either coordinate rides from the office to and from, or I can just leave them there. You're safe. I'm gone. Right. We're good. You can integrate at home. So yeah, when you arrive in the session, we start just like you would any session. What is your intention? What are you seeking through this medicine journey? What's bubbling up for you? We get really clear on the mindset, on your intention, on your affirmation. We might do a little breath work or movement, just get you out of the mind into the body, because you're preparing just to let the logical mind go away. In this CAP model, it is those little, what do you call them, little now and later, like candies, the little waxy squares.
Trophy.
Yeah, yeah. So people put that in their mouth. It's you swish for 15 minutes. Sometimes the medicine's working, so you might not feel your mouth moving as much, but you swish during that time.
Your mouth gets a little bit numb.
Right? So it feels like you are a chipmunk with the saliva working with the medicine. Your mouth pops open. It feels like it's gonna pop, but you never do. It just is like this weird feeling to start coming through until you've done it a couple times. With my clients, we always do like some sound bowls with a guided meditation. So I help to bring you in to the space, and then not the whole 15 minutes I'm guiding, because at that point the music will take over, because you don't want to really hear the words. After the 15 minutes, you spit the medicine out, and then the music journey with the headphones come on. You have an eye mask, a blackout eye mask on. You fully recline, and you feel the body start to settle. Generally, people are in a journey. I've seen it as fast as 45 minutes, as long as 2 hours. but
Oh.
usually it's like a 75 to 90-minute sweet spot. Usually it's in there. 60 to 70. 75 is usually the main one, where for the majority of people, they're really not talking much. It's a really inward experience. If they are talking, I'm kind of taking notes for them. Um, some people have a little bit of movement, but overall, people are generally pretty still for the first 45. Then there might be a little bit of movement, might be some awareness. You know when you're ready to come out. Some people kind of peek, they look, they go back in, not ready. But usually around the 90 minutes, everybody's usually finished. And then as you come out, you just feel this kind of new awareness. The medicine is still kind of fading out. There's this trickling effect as you kind of do this light integration, this noticing. And then it's nice to reset in the body, because with ketamine, you want to fast for about 3 to 4 hours beforehand. So that, there's sometimes people feel some nausea in there, but when you fast, it kind of takes that away. It increases the effectiveness of the medicine. So afterwards, people generally are pretty hungry, but it's also a nice way to reset you back into your human body. You left it for a little period of time, right? Brings you back into the body. And at that point, people generally have some new awareness of what's going on. They share some thoughts. I try not to make it a really big processing day, just because the subconscious is open. We kind of move that to the next day. We check in. And that's when you can really harness that critical window of time, those first couple of days of, what are those new thoughts, those new patterns, these new habits that I'm engaging in, and really taking advantage of that window of neuroplasticity that's so ripe, and, everything's so lubricated in your mind that you can really take advantage of.
And how do you determine the dosage of the medication? Is that by you, by the doctor? Who determines the dose?
I can talk a little bit about that, but I do want to mention just one thing. As you're coming back into your body, as your mind kind of re-inhabits your body, sometimes you will get a new awareness of what your body feels like.
Yeah.
As your sensation comes back online, like, oh, that's what my hand feels like, or that's what this place where I have this, this trick knee feels like. It's really interesting to step away and come back in. I don't want to call it being born again, because that's so loaded with other things, but it really feels, it's almost like hatching. I don't know how to describe it better than that. So,
That's a good
your other question, dosing.
Dosage.
Yes. So, I'm talking about the sublingual route specifically. Average working dose is 200 milligrams, and so we provide 200 milligram troches. It depends on kind of what your goal is. Some people prefer to go much lighter on the medicine, what we call a psycholytic dose, which kind of helps to open you up a little bit heart-wise, but doesn't take you into a psychedelic experience. And then on the other end of the dose range is a more psychedelic experience, where it's more meditative and much more like what Sarah described. Different people require different doses. Some folks will start with half of a 200 to just a test dose to see where you're at. You can take a booster dose after maybe 20 or 30 minutes if that's not enough. I do have clients that need 1.5 or 2. A very small percentage will need more than that. That's much less common. So most folks, 200 to 400 will definitely do the trick.
And what's nice about this is, they give you a range, and obviously, we're kind of working in collaboration as well, but it's not the same as the average model that you have. Here is your pill, take it every day. Don't alter from the dose. If you alter from the dose, you have to talk to me. This is not okay. Like, that model is very ingrained in us with normal prescriptions. In the psychedelic realm, you are the one who knows yourself best. It is about you tapping into that wise teacher within you. So we will give you that framework of, how low or how high, what's a good range to play in. And if you feel like you need to go higher or lower, let's talk about it. But you are going to have the best knowledge around yourself. And part of this work is allowing yourself to not let me be the expert of you, but you allowing yourself to be the expert. And so that okay, like, this feels like my dose today. Maybe it was 200 last time, but I feel like I want to do a 300 this time. My mantra is I always take the perfect amount, whatever that is. I always take the perfect amount. I always trust it.
The
And that also,
interesting thing
yeah,
too is if, let's just say you overestimate, you get cocky, if you want to call it that,
yeah,
and you're going to come back. You
yeah,
might go a little deeper than you were
yeah,
planning. It might be a little trippier than you were planning. You might even feel like you left the universe. You always come back.
yes,
This has such a
yeah,
short acting drug that
yeah,
just sitting with someone and being there for them and reassuring them if maybe they're a little scared, they come back very quickly.
it's
It's
true.
a very
Mm,
forgiving medicine.
nice to know.
Yeah. And then
Yeah.
some people will take it, once a week if they're treating depression, or sometimes twice a week. Some people do it every 2 weeks. Some people do it once a month. I have some people who do it once a quarter. But there's these different routes depending on what you're seeking, what you're healing. I see a lot of people who will do kind of 6 treatments once a week to get this kind of multiplier durability effect where you are keeping the medicine and neuroplasticity in your mind and body, creating these new habits, and then you take a break. It's not something that you are meant
Mm,
to do forever and always. It is a
right.
tool that you are using to heal, and then you take a break and you integrate, and you still have the medicine for this longer period of time when you kind of stack it at the beginning.
Mm,
But that's the
yeah.
beauty of it, is it's meant to be something that you step away from. You heal the root cause.
Mm-hmm. So, Dr. Eric, when you all were on the panel, you spoke about it being used in hospitals for suicidal patients. What's making that so effective with that diagnosis?
So, the classic thing if you came in with suicidal ideation or a suicide attempt is you get to the emergency department, we stabilize you. If there's some antidote that needs to be given, we do that. And then we send you off to the psych hospital for 72 hours. And that whole process of being in the emergency room and then maybe ended up behind locked doors is very traumatizing for folks. You're
Mm,
often very exposed. There's not a safe container. Emergency departments aren't designed to be, therapy. They're really just make sure you don't die or bleed to death or whatever, and then stabilize you and move you somewhere else. So terrible place to go if you're hurting so much that you wanted to take your own life. But that's our standard way of doing it. Understandably, we want to protect people.
Mm-hmm.
So ketamine, when used in that setting, you give a single either IV infusion or an intramuscular injection. Within 2, 3, 4 hours, that intense desire to just end your existence goes away. Uh,
mm,
it may be, obviously in that period of time, you haven't grown a whole bunch of new synaptic connections, but there's just some property of the medicine. I don't know if it's that metaphysical piece where you, again, look at your problems from a different point of view and say, you know what,
mm,
maybe that's not as bad as I thought. I'm not really sure how. I just know that it does. And so, in some emergency departments now, that's their protocol. They'll do that, maybe hold
mm,
you for 6 hours, see how you're feeling. If you seem like, hey, okay, I'm not going to go out and do anything, promise you. Um, they get them plugged in with follow up the very next day, either with therapist, psychiatrist, some others person that can follow up, help with medication regimen, maybe get them into a series of IV infusions if they need that.
Mm-hmm.
And that really works well. It's not being done
mm.
everywhere. It's not the standard of care in every single emergency department. It really should
Not
be
yet.
yet. Yeah,
Not
that's what I'm
yet.
saying. But
Yeah.
we're slow to change. We're
Yeah.
doctors, right? We're
Yeah.
slow to change and to go, and we're just, we're taught like, treat, hold for 72 hours, move on to the
Mm-hmm.
next person.
Mm.
And that's changing, thankfully.
Mm,
I think you kind of
oh,
tapped
wonderful.
into a good space talking about that metaphysical, because there is this whole side. Obviously, mom and I love to talk about it, but the spiritual side that
Mm,
this medicine does, this existential space where people are feeling their ego dissolve,
Mm.
this part of self dissolve, and you're stepping into this spiritual realm. Can you speak a little bit to what you notice, what you see, and I can also add in.
Was that to me or?
Yeah, well,
Okay.
yeah,
I,
to
I wasn't sure
you.
what the question was. Yeah.
Yeah.
So absolutely. The higher the dose, there is more of this ego dissolution where
Yeah.
the boundary between you and the rest of the world kind of seems to dissolve. You hear about that talking, in classic psychedelics, having a unitive experience where you're one with the universe, or you just feel yourself as energy floating along. Some people have an experience of meeting their higher power, of being in the presence of that higher power. I've experienced all of those things, and they're actually quite beautiful. it's the sort of thing you would love to go back to predictably, but it happens when it happens. And if it happens, it's a gift. A lot of people don't get that, and that's okay too. As you were saying, Sarah, you get what you need. Um, so, so it can be, it certainly takes you out of your day-to-day existence.
Yeah. Well, that's kind of the part that you talk about where earlier the small things start to fade away. When you have that experience where the ego dissolves, you step into the spiritual realm. One time I remember saying, like, I was just like dancing in the ethers. Like, I just was living up here, and, people have gone and met their spirit team or connected people who, pass on the other side. And there's this more expansive oneness experience, so that when you return, these human things that we grip, these small things, just feel so insignificant. And I think that's that remembering that, when we're doing hypnosis or past life regression, that you're able to access that. And it's that felt sense of feeling it, where we don't have the language to really speak so as eloquently as we want to what that experience looks like or feels like, but it is a gift when you tap into it.
Nice. Wow.
Yeah.
We've covered so many wonderful things.
Yeah. I think maybe if there's anything else that you want to share, Dr. Eric, if there's anything that you're excited about coming up or that you're looking forward to in the field or something else you'd like to share, we'll kind of wrap at that.
Oh man, I wasn't prepared for this question.
I know. Well, just, any other notes.
Curveball. Well, gosh, I don't have any specific events or anything like that coming up. I'm fully supporting the therapists that I'm working with to do both individual and group work. There's a lot of that stuff going on. It's really starting to take off in Orlando. There's a lot of other parts of the country that's going on too. Super excited about that. Folks are doing way more than I could ever possibly do on my own. You have skills and training that I don't have, and it's just fun. I'm really having a lot of fun collaborating and seeing the results of our work. So that's good. I'm definitely, there are other medicines out there besides ketamine. There are, psychedelic mushrooms, psilocybin, LSD, MDMA, other compounds out there as well, 5-MeO. Those also are tools for change. They can be a little more challenging to work with because they are much longer lasting, but their neuroplastic window is also longer lasting. And so, I think what we'll have as those substances get either approved by the FDA or at least decriminalized in individual states, which they have in some already, what we'll see is different tools for different people, and maybe even different tools at different points in their healing journey. There, differences in each compound that make them better in certain situations. And so it will become a real art, sort of like, okay, which one do we work with here? So I'm really looking forward to as well. It's been a rough road. We thought that MDMA was going to get approved by the FDA through the trials that a company called Lykos had done. They've shown tremendous benefit in PTSD and treatment-resistant depression. The FDA did not approve it. They want some additional studies done first to prove safety. Again, the medical field is just slow to change, and this is such a different thing as opposed to just take a pill, take it every day, and you'll be fine. This is talking about isolated experiences with life-changing results, and they don't really know how to evaluate that. It's been a real challenge for the powers that be.
I've got one last question for you because it just popped up in mind as you were talking, because you were saying before the show that Orlando is just kind of popping now. All the work, Sarah's just pop, pop, pop with the others. What other parts of the country are really into this just as much as Orlando is becoming, would you say?
Well, I can speak to my own experience. I have about 60 so therapists that I collaborate with in 10 different states. The main kind of the big clusters are in the Kansas and Missouri and Colorado area. There's a big cluster there of people that, you get one or two people that do it, and then a couple other therapists hear about it, and they maybe train with those people or train with others, and it kind of just mushrooms out, excuse the pun.
I know.
But it does. And then similarly, there's a big cluster in the DC, Virginia, Maryland area.
Oh, okay.
but I'm also in North Carolina, Michigan, and Washington as well, where
Oh,
there's just
interesting.
starting to take off in those areas. But the other two that I mentioned, big, a lot of stuff going on. It's super exciting. It's just fun to watch.
Oh,
And I think what's been really beautiful about collaborating with you, Dr. Eric, is that you also hold case consultation calls. So not only, am I just connected to some people in Orlando, that when we get on these calls, there's people in all these other states that, are working with Oasis that we're also able to work with, and I can run cases and what are they doing, because it is an emerging field. And so hearing how people are doing the work and what kind of results they're getting, I mean, what a gift. I mean, I just have never worked with a doctor like this. And so it feels really, really beautiful to have, you know, you who is so like heart forward, and also, like the goal is to connect and to collaborate and to lift everybody up. It has been just a beautiful way to engage in
Mm.
this work, and that you can see the results are because of that. So thank you.
Thank you. Thank you.
Yeah.
boy, you have found your purpose in this lifetime, haven't you? Oh my
Well,
goodness.
I look back over my life and, I'm glad I did intensive care for a while, but, I look at the problems I've had with childhood trauma and with, bouts of depression and my own struggle with addiction and recovery. And I can see now that all of those things were like my training ground, basically, that
Mm,
allow me to be really good at what I'm doing now because I understand it and
Yeah.
people get that. They feel seen, heard, and appreciated and validated. And you don't always get that in the doctor's office. So
mm.
thank you for the compliments. I totally own those because I think you're right. But
Yeah.
you've also reminded me I need to schedule our next CAP collaborators call with the therapist. So that's why I was taking a note there as you were
I
talking.
love it. I love it.
Oh, well,
Oh
thank
man.
you again. Thank you so much. I mean, it's just such wonderful work you're doing. And this has been enlightening as always. Every time I hear you speak, I learn, absorb, and integrate another piece every single time. So
Well, we
thank
can
you.
all learn from each other. That's for
That's
sure.
Oh,
it.
great.
That's all of it. Thank you, Dr. Eric, so much
It's
for
my
taking
pleasure.
time
My
to
pleasure.
have this conversation. That was such a great conversation with Dr. Eric. So great.
Fascinating. Absolutely fascinating. And it just, all it does is always gives me another nugget, another nugget, another nugget, and looking forward to the next journey I'm going to take as well.
Yeah. Well, and it's really, I think once people have the information and they understand it, you have that,
Yes.
your brain can settle and you're like, oh, this makes sense. Now I can really lean in. And so I'm just so thankful now we have this resource and people can hear about it, understand it, because
Yes.
with any kind of new therapeutic modality, it's like once you have the knowledge around it, now it's safe to drop in.
This will be a wonderful episode to refer people to. Absolutely wonderful. So happy that you introduced him to me. He's great. He's just great. And the two of you, we have a lot of synchronicity, a lot of compatible thinking about it, and all the metaphors that you brought in were fabulous. So it's a really, really great interview. I love this one.
Yeah, you
Yes.
can feel when it kind of just flows together.
Yes, yes. It was great.
Cool. So, what's the affirmation, Mom?
I think the affirmation is I trust, let go, and am open to discovering the healing potential of my mind, body, and spirit. Yes. I think that says it all, doesn't it?
Kind of the mantra of psychedelics, right? Trust,
Yeah.
let go, and be open, and that's the window to the subconscious.
Mm. Well, what are you going to use
I
today?
grabbed my cards that are the universe has my back.
Oh, perfect.
The universe
That's
has my back,
perfect.
your back, our back. It is
Yes.
really great,
Perfect.
by Gabby Bernstein, who yeah, she's put out a new book that I've been really getting into called Self-Help, and it's all about kind of
Hmm.
IFS parts work that's really helpful for people to go into. It's a really beautiful blend with psychedelics, actually. And so,
The parts work, like Virginia Satir's work.
yeah, then it went into Richard
Yeah.
Schwartz.
Yeah. Nice.
All right. So go ahead and jump in cards.
Oh, must be important ones.
Jumped. When I lean on certainty and faith, I change my mind about the world I see. It's
Oh,
the third eye. Just
I
I
love
know.
that.
I was like, oh, popped out.
Yep.
Okay, so wherever you are, be able to ground how you are. If you're driving, just get a little bit, more relaxed in your seat. Let your jaw soften. If you're able to close your eyes, go ahead and do that now. And as you do, feel yourself, the shoulders soften, the belly relax, the mind open up. And ask yourself, what number card is yours today? Number 1, 2, or 3, and the first number you see, feel, or just know to be true. Let that number arrive within you. And trust. Let go and be open. Card number 1. True healing occurs when I give myself permission to feel whatever feelings live below the triggers. Card number 2. When I'm in alignment with the love of the universe, peace cannot be disrupted.
Nice.
Card number 3. Through prayer and meditation, I create a ripple effect of peace in the world.
Love
These
these.
are beautiful. Yeah.
Love them.
Love it, love it, love it.
Well, yeah,
so
for those that are interested, I think we have some ideas for some interesting retreats to come, huh?
We do. So be sure you stay, plugged in with souljourneysretreats.com. Soul Journeys with an S, retreats with an S. And we can keep you posted on what's coming up because we will have some new and novel and fun things planned. So just stay tuned. You can follow us on Instagram and everything's in the show notes. And if you have any questions, just reach out to us. We'd love to chat about this work and what we're doing. And we just hope you guys have a beautiful day and trust, let go, be open to the healing process.
And be sure and be on the lookout because we have some great other interviews coming up for the new season. Yeah. Take care.